Uh, there's not a whole lot new that I think has come up this week, but I think there's some thoughts that we can start to put towards what may be to come in the next little while. Starting off with the Ontario kind of case curve, it's looking like this. And I think the one little bit of good news is that for a few days, the average daily cases in Ontario seem to start to trend downwards. Now that could be, these sort of unusual little, aberrations where we have, and it's going to, it's just a little blip. I'm hoping this means that we've passed the peak and things are actually on the way down now in terms of cases in Ontario. And we are about 3 weeks out from the stay-at-home order, so it does sort of fit with the timeline of when we would expect to start to see that impact. So about 2 weeks after that stay-at-home order, we started to see the difference. And so hopefully that's what we are seeing. When we take a look at hospitalized patients, of course, hospitalizations are a lagging indicator. They don't respond as quickly, so we don't really see as clearly a decrease there. There may have been a little bit of this kind of aberration where it dips briefly. That seems to occur every weekend, with maybe hospitalizations not being reported as well by hospitals on weekend. But I expect the hospitalization number will continue to go up. And I think everybody's heard lots about the ICU numbers. We are well over 800 now in terms of ICU admissions. And the province used to have a threshold of 150 was getting into the danger zone. So we are unfortunately well past that. What the modeling showed was that we would expect the peak to be somewhere between the 23rd and the 30th, according to this, if we're on that green line. So the good news is that I think the modeling seems to be right, that we did seem to peak around there, and we fortunately started to head back down. The key thing, though, that the modeling showed was that you could be on this dark line, the solid line, where you reopen after 4 weeks and you jump right back up, or you stay in the stay-at-home order for a full 6 weeks, and then you still head up, but you head up more gradually and in a more controlled way. And that's because of the difference of you've brought cases lower, so you've reduced risk of infection spreading because there's fewer people infected to spread to others. But you've also had 2 more weeks to get vaccines into arms and have the benefit of those vaccines helping you. And I think that's going to be the real key now is, do we sustain the stay-at-home order long enough to get us to a point where it is safe to reopen, or do we unfortunately rush to reopen again? ICU admissions, the province is of course predicting that this, the modeling table is predicting that this would continue to go up for quite a bit and wouldn't peak until really the early part of May. So hopefully we might see end of next week a peaking of the ICU admissions and hospitalizations. I'm going to switch over now to just look at Niagara's case curve. And you've probably noticed our case numbers the last couple of days have been unusually low, and we would agree with that. That's unusually low. We've noticed with a pattern of the data that's been coming in from the province through labs that the volume is a lot lower, both of positive cases and negative cases. And so we suspect there's a problem with the data feed of sending us reports of COVID cases. And so we don't think yesterday's and today's case counts are actually a true reflection of what cases actually are. I've therefore drawn the case curve here to leave out the last 2 days, which I don't think would be an accurate reflection of what's going on. Hopefully we'll get a resolution from the province soon on that issue. It's something we escalated to them yesterday and are working with them to try and fix. We start to see what our accurate case numbers are. But if we leave out the last couple of days, which would be skewed, you can see that our numbers were still going up here in Niagara. We'd be basically hitting similar peak of what we had in the second wave without yet seeing that decrease. Hopefully that decrease is coming, and once we get the data from the last couple of days corrected, it'll show that as well. Just taking a look here at our mobility data, of course, the whole point of our stay-at-home order is to keep people from being out and about and interacting with each other. And so that will reduce the spread of infection. And we had seen that mobility was still higher, people going out and about to shopping and recreation as compared to the second lockdown or the first one. And it seems to be improving. We're still seeing a decrease in the mobility there. So I think some of the additional messaging, some of what the province is continuing to encourage is helping us get closer there. Obviously, we would like to see something closer to what we were at the second or even first lockdown, because the more sharply people reduce their being out and about, the more sharply we can hopefully bring cases back down and get to a position where we can start to reopen earlier. And just looking at the flip side of the mobility here in terms of people staying home, and we are again seeing a little bit more people are staying home. So that's certainly, the direction we hopefully will continue to see this line go up. And again, people stay home, that hopefully limits the spread of infection a little bit more. Just quickly look here at the hospitalization and ICU situation at Niagara Health. And you can see we are definitely trending up with the number of people in hospital from COVID, as well as a bit more gentle here, but definitely it has increased the number of people who are in the ICU as well. So now I just want to flip over and look a little bit of what the federal government put out in terms of modeling last week, because I think there's some interesting lessons we can get from that here. So this is the model of national cases, and they had done a model around this point and near the end of March, and had this gray line of where things were headed if we didn't do anything. And then we're proposing that if we are able to reduce number of contacts each person has by 20 to 30% by stay at home, all of those sorts of measures, we could shift onto this purple trajectory where things flatten out. And the red dots are where actually daily cases have been since they actually did this model. And you can actually see that daily cases have pretty much tracked what the model has shown. So, I think a big thing we're seeing is both the Ontario and the national models seem to be extremely accurate at predicting, at least over a few weeks, what we can expect. And we should be really trusting them in terms of guiding some of our decision making. Obviously, we didn't get on that purple trajectory, and so we are going to have to do more work to bring cases down to a flatter level or even lower level. And I'll just show you, the purple line was reducing contacts by 20 to 30% starting in late March. This is their more up-to-date modeling, which is now showing to get that flattening out. We need to do a full 30% at least to see that. And to actually bring cases down, which is I think what we need to, because the current level of cases is really maxing out our hospital systems, we would actually need to reduce contacts by a full 40% and bring that down. And I think, this data here shows the benefit of if you acted early, there's potential to hopefully reduce cases at a point where it wasn't so overwhelming to our healthcare system. And it's just making it even more difficult for us now to hopefully bring things under control. The federal government did a bit of modeling here as well around reopening scenarios. And they put out the scenario that if we continue the current measures that are hopefully going to bring cases under control and we get vaccine uptake to about 75%, at that point, you could actually safely reopen in a way where you wouldn't actually see a spike of cases that overwhelm our hospital system. And so they're very much advocating this is one of the thresholds that we should be looking at, that 75% of people have received one dose of vaccine. If they looked at the scenario where you reopen earlier with maybe only 55% vaccinated, and what you can see here is you see a big jump up in terms of the number of cases, and it exceeds this dotted line. So this was hospitalizations, not cases. And so hospitalizations exceed the hospital capacity. And so this is really calling for making sure we don't reopen too early, that we stay with our measures long enough that we're able to bring cases low, so the risk of infection spreading is lower because there's fewer people who are infected to spread, but also that we get our vaccination rate high enough that it's going to be able to actually keep cases low at that point. And that looks like it's around 75% of people need to be vaccinated according to the federal government. Just want to show you again with this graph I showed you last week, which was the United Kingdom. And the United Kingdom had a lockdown in the month of November, brought cases down a little bit, immediately saw a spike back up when they reopened in December, and mid-December went back into lockdown. And we're really in lockdown from mid-December to mid-April. And again, what they were trying to do was keep the lockdown long enough that they brought cases down to a low level where infection couldn't spread, but also give enough time that they could get a lot of vaccines out to people. And the UK is now sitting at, I think, around 60% of people vaccinated. And so that combination of having cases low, as well as a big proportion of the population, is what has enabled them, as of a couple of weeks ago, to start to reopen. And hopefully that, so far so good, but it's a bit early probably to tell for sure. And then, this is just comparing where we are in Ontario and what we would need to do to get down to the kind of level of cases that the UK had. Looking here at, hospitalizations, similar kind of story, that they brought their hospitalizations down to match with that extended lockdown. And then, looking at ICU admissions again, that comes down as well because they had the extended lockdown here. So this is a final thing that the federal government put out, which I think is notable, that they're saying 75% and bringing cases down is going to be the situation where you can reopen. And there's maybe a few things that help you get there faster. Obviously, if you get vaccines turn out to be more effective than we expected, or particularly more effective against the variants that are circulating, that's going to help. If we get more people vaccinated earlier or more people vaccinated, that's going to, of course, help us. So if we're above 75%, that's going to help. Controlling transmission, testing, tracing cases so we can keep the numbers low again, bringing the number of infections lower so there's not as much opportunity for them to spread. And if hospitals and ICUs have capacity to meet the volume of cases being hospitalized, that of course creates opportunity that we don't need to worry about as much about them being overwhelmed. I think this is the least likely of these that's going to arise because we are already at a stage where they are pretty much overwhelmed, and we really need to bring the cases down to again be sustainable. Just taking a look then at what our vaccination coverage is, and if we're thinking about 75% target, I'm just going to draw in here all of the different categories. And the blue line is what I actually showed to you last week. And I've drawn in orange what is the change we have seen over this past week to kind of get a sense of what's happening in vaccination. So we were at 95% of our 80 plus vaccinated last week, and now we're at about 95.8%. So typing that up a little bit, and we actually have bookings as high as to get us to 97%. We've gone from 91.5% to close to 93% in the 75 to 79, increasing the 70 to 74 to about 81.5%, and we have bookings that'll get them to closer to 87%. Obviously, the 60 to 69 age group is the age group that is most recently eligible for vaccination, so most of our vaccination is being done in them, and we've gone from a third to now over half of this population vaccinated. I think it's just under 52%. And then, overall Niagara residents were at 26.1% last week, and now we are at 31.5%. And so we're adding a little bit over 5% every week to this total. So if we're thinking about that federal government target of getting up to about 75%, we're maybe just about halfway there. We need about 6 to 7 additional weeks before we're going to get to that 75% target. So I think realistically, we should probably be looking at the early to middle of June before we're at that target, and we're going to have the conditions in place where we can reopen. And that, I think, reflects some of the earlier modeling showing that we would need to have at least a 6-week stay at home or heading into the latter part of May to drive cases to be at a relatively low level. I think that's probably based on what the federal government is saying. To have vaccinations and match those criteria, we need to keep that up until probably early to mid-June. And so I'm sure that's not the news anybody wanting to see, but I think the data is pointing that's going to be the situation that gets us to a sustained reopening. Last thing I just want to highlight here is that, of course, the 70 years and up group is really the group that we've vaccinated. Particularly the 80 plus have been at a high level for quite a while, and we're getting that 70 to 79 group up even higher. And it's really interesting when we look at the age breakdown of where our cases have been. So, if we draw in all of our cases here, of course, the 20 to 39 age group remains the group where we're seeing the most spread of infections. Partly that perhaps is due to the behavior of young people, but it's probably also due to them having many of those service jobs in grocery stores, pharmacies, kinds of, outdoor work where they don't have the opportunity to stay at home and work a white collar job. And that probably puts them at some greater risk. You can see the 40 to 59 age group is pretty similar. The under 20 age group has unfortunately been rising as well. And that's probably a reflection that in many cases, these are children of these groups. So if these groups get infected, the infection is going to spread to them. But it's really interesting here that you see the 60 to 79 age group hasn't risen as quickly, and it seems to be leveling off. And that's the group that we've most recently been able to get vaccinated. The 70 and above group we saw is over 80% vaccinated. The 60 to 69 group is now 50% vaccinated. And as we're getting vaccines, that perhaps is contributing to this starting to level off, and the vaccine effect is working. Now, if we look at the 80 plus group, we can see that this group has come nowhere near rising as high. And this is a group where we already have very high vaccination coverage. And I think this is really just an indication of how well the vaccine is working for us, that once we get groups vaccinated, we don't see them getting sick from COVID as much. Yes, they still do. This number has definitely increased as more COVID has gone around, but the vaccine is doing a lot to protect this group, increasingly is protecting this group. And if we get to that 75% of people vaccinated, most of these other people will be vaccinated. And so that'll create the conditions where even if we don't have as many measures in society to slow the spread of infection, the vaccine really does seem to be effective, and it's going to really help us be able to reopen in a sustained way. And with that, I'll turn it over to questions. Do I need to give you control back? Sorry.
I was looking for the reclaim host button. All right, thank you, Dr. Hergy. So up first, we have Ludwig. So just give me 1 second to find you and unmute you. There you go, Ludwig.
Thank you, Meredith. Hello, everyone. Hello, Dr. Hergy. Yeah, so it kind of was explained a little bit on that infographic you showed, what the factors are that could allow for a sooner and a later reopening. I was going to ask you about what, the status that we're in right now. What would you say is the biggest risk factor to the trajectory, turning into a less favorable one? We see, like, as you said, a small dip in the provincial cases, and I'm wondering basically what are some things that could throw us off track now? What are the biggest risks to this, if this indeed is a stabilization of the situation?
Yeah, I think the biggest risk would be similar to what happened in the second wave, where we aren't patient and we rush to reopen, or even we aren't patient and the government doesn't reopen, but people lose their patience and decide to start being out and about more, having the social interactions, particularly as they get vaccinated. And that allows infection to actually start to build up. I think that is the biggest risk. It's really our own discipline to stick at this out until the early part of June, which is a fair number of weeks. And I think that's going to be what really determines what happens from here. A couple others I'd mention is that if there are new variants or variants that are less well controlled by the vaccine or spread more easily despite all of the measures we have in place, I think that could be another concern. I think about the Brazilian origin variant, the P1 variant. We do see that growing in Ontario. Fortunately, it's not growing at an overwhelming rate right now, so it's not as big a concern. But if that did really pick up, that could be a particular concern because it seems the vaccine is less effective against that. And then the one other, I think, potential danger here would be if there's some sort of disruption to vaccine supply and we're not able to keep up at this pace of vaccination. And my sense is that's unlikely to be the case. I think, while there's been some instability in some of the vaccines, the Pfizer vaccine, which is really the mainstay of our vaccination program in Ontario, that seems to be coming in reliably. And it looks like the amount of doses are actually going to be increasing by the time we get to June. So I would think that the biggest concern is really just our discipline to stick out with some of these stay-at-home measures through to the early part of June.
And a follow-up, Ludwig?
Yes, thank you for that. And a similar question to what I believe I asked you in the second wave and probably in the first wave as well. Assume that we all do our due diligence now and allow the vaccine supply to sort of seep into Niagara here and stay at home and keep the infections down and hope for no major changes to that. What could early June look like for a person who is perhaps a young adult and who is maybe not need to be as diligent as perhaps a person who is severely immunocompromised, maybe someone who's going through chemo, etc. Like a regular healthy person, what could they expect to be able to do in early June or perhaps towards the later part of June or even during the summer? I mean, what types of activities and what type of restrictions do we need to observe during those stages? Thanks.
Yeah. So key thing, of course, is that's looking like when we get to about 75% of people vaccinated. So that's not 100%. And the group who's least likely to be vaccinated will be the younger people, because that's who is last in line to get vaccinated, because of course they have the least risk of severe illness and death. As well, if people, that 75% who do have a vaccine, most of them will only have one dose of vaccine, so they won't have the full protection of the vaccine. And regardless, no vaccine is 100%. So I think some of the less onerous measures that we've practiced are going to continue on. We'll still be keeping physical distance when we're out and about. There'll still be all those markers in grocery stores about, keeping 2 meters distance in the checkout line. We probably still will be wearing masks when we are in indoor spaces. We'll still probably be doing a lot of sanitizing our hands, because the risk won't be gone yet. Those are sensible, easy enough measures that hopefully we'll be able to continue. But what I do see happening is that we'll be able to start to roll back some of the really more onerous, especially economically onerous restrictions. So a lot of the businesses that are currently closed will be able to reopen. I'd say dining will be able to reopen, with outdoor dining particularly. I think at the first phase, that's something that can come back, and we know the risk is relatively lower when we're outside. So, allowing restaurants to really reopen and have the patios that we saw last summer again. I think we could see some other kinds of places like personal services, like barber shops. Everybody wants to get a haircut. They could reopen, perhaps would have some limitations and capacity restrictions, but they would be up and running. Lots of our stores will be able to increase the number of people they have indoors. Malls will be able to allow people to be in stores again. I see those sorts of restrictions being the first ones to be lifted. And then over time, I think there could be opportunity for maybe some of the kinds of artistic performances to open, particularly if they're able to do a play outdoors, or they're able to do those plays with a large amount of ventilation. That could be something that could occur again. I think, personal kind of events like weddings, etc., I'd see the capacity limits for those to be increased, particularly if they're held outdoors. And then hopefully while we get into the fall, as the weather's not as nice, as outdoor activities aren't as easy, we'll have even more people vaccinated, most people vaccinated with 2 doses, and we'll be able to start lifting even more restrictions for the indoor activities.
Okay, thanks, Ludwig. Up next, we have Steve from Cogeco. Do you have any questions, Stephen?
Hello, everybody, and I hope you're having a good day. Dr. Hirji, the new, I guess a lot has been, I shouldn't say a lot, sorry. How will the new variant discovered in India factor into, I guess, the plan that the federal government put out? I know it may be difficult to answer that because there's not enough information possibly at this time.
Yeah, no, I think we don't have enough information. We obviously see things are spreading out of control in India. Is that because this variant spread so easily, or is it some other factors that are causing that, and this just happens to be the version of the virus that is spread there? So I don't think we have a great sense of how transmissible and how dangerous this new variant identified in India is. So it's hard to really say what how it would factor in here. I think the good news so far is that we haven't really detected it in Canada, at least not in any kind of significant numbers. And I think our goal right now needs to be try to prevent it from arriving here. So the federal government has, of course, announced some travel restrictions to limit its ability to come here. Given we are in a stay-at-home order situation, hopefully if there are cases that arise here, they're ones that we can identify and contain the spread of those cases at a higher degree than we're doing for all our other cases, to make sure that that variant doesn't get any kind of beachhold here and is able to sustainably spread. And if we do that, then I think we're safe no matter how dangerous that variant is.
And a follow-up question, Stephen?
Yes, if we don't hit, I believe it was 55% that you said would be a plausible in terms of vaccinations. Let's say we're going along with 5 to 6% each week, like you've shown us already. And let's say we get to only maybe 50% because there are people that just don't want to take the vaccine. Will we possibly see a third wave come, or would it be fourth wave? I think at that time, come this fall. because people stop taking the vaccine because they just don't want to take it. There will be that small percentage. I don't know how many will refuse it, but could we actually see that moving forward?
Yeah, so what the federal government said is we need to get to about 75% vaccine uptake to be able to reopen. If we're at 55%, that does, as this graph shows, lead to a spike in hospitalizations, and that spike in hospitalizations basically means there's a much bigger spike in cases happening at that same time. So absolutely, what this is showing is that if you reopen it at 55% with not enough people vaccinated, you do get an additional wave of infections and a wave of hospitalizations and likely death that comes along with it. So that's absolutely a concern. I think the key there is that if people aren't getting vaccinated in high enough numbers, you would first off need to stay in a kind of lockdown state to at least drive cases even lower before you can reopen. When you do reopen, you're not going to be able to reopen as fully, or you're going to have to continue working during that time while you're driving cases even lower to try and reach out to those groups who are not getting vaccinated to hopefully get them vaccinated so that we do get the benefit of that. So it absolutely, if we do reopen with only 55% and we have a bunch of people who are not willing to get the vaccination, it does absolutely lead to another spike. And I think that means we shouldn't reopen because we're going to see this spike in hospitalizations, and that's going to overwhelm our healthcare system.
Okay, thanks, Stephen. Up next, we have Richard Harley.
Yeah, I just wanted to check in. Last week, you said it was possible some vaccine might be diverted from Niagara. I'm not sure if that happened or if anything was done with that, but I haven't heard about it. So just wanted to get a follow-up on that.
Yeah, I haven't heard anything specifically around that. I think what we have seen over the last week was that it sounds like there's a lot more Pfizer vaccine coming to Canada in the next few weeks. And so the way this might play out is that we don't actually have vaccines so much diverted from here as all of the extra unexpected new vaccine maybe goes to the hotspots, and that way they don't have to change the pace of vaccination here, but they're able to speed up the pace of vaccination elsewhere. That's speculation on my part. I don't know for sure what's happening, but I do think the province is thinking very seriously about prioritizing more vaccine to hotspots, because that has been shown by the science is going to slow the spread of infection and save the most lives and prevent the most hospitalizations, especially in the GTA where the hospitals are overwhelmed and where most of the hotspots are.
Awesome. And do you, where is the extra vaccine coming from? Is it coming from the States or?
I doubt it's coming from the States. The US is apparently not allowing their vaccine plans to ship any vaccine outside of the country. I think all of our Pfizer vaccine has been coming from the Pfizer plant in Belgium. And so I imagine it's additional production they have there that we're receiving. That's a better question probably to ask the federal government, who actually does the procurement of vaccine. They will be able to provide you a definitive answer.
Thanks, Richard. Up next is Penny Coles.
Hi, thank you. I just, Dr. Hergy, when you're talking about vaccine supply as being one of the factors that could impact your June reopening scenario, and we know that Pfizer is sending extra supply and it's looking good for the next couple of weeks, but I'm also hearing that some pharmacies and primary care clinics, doctors are canceling appointments that they've made because they don't have AstraZeneca, that there's a shortage of that. Is that enough to have an impact on your reopening expectations or hopes?
Yeah, I think if we don't get as much Pfizer vaccine as hoped, it does have an impact, but it has a relatively small impact because AstraZeneca, has been a relatively small portion of the vaccination going on in Niagara and really in Canada as a whole. The mainstay of vaccinations happening in Canada is with Pfizer. I don't know what the exact breakdown is, but I would guess it's, on the order of 75% of our vaccinations have been with Pfizer. And so if you increase that significantly, that's a huge amount. The Moderna vaccine, and then a little is probably next, and then AstraZeneca has been the smallest portion of the vaccination we do. So, I think it's really unfortunate if we don't get more AstraZeneca. It means that we don't have our pharmacies and primary care as easily able to support our vaccination. So it does limit the number of options out there for vaccinations, but it still allows us in public health, Niagara Health, to continue running our mass clinics where at least about 70% of our vaccination is happening. And so, I think it'll make a small dent, but it's not going to make a huge dent if we don't get it AstraZeneca.
And a follow-up, Penny?
Only that AstraZeneca has been seen as really helpful because pharmacies are allowed to offer it at lower age groups, are they not? So that maybe it sort of impacts the age groups which are able to receive vaccines.
Yeah, no, that's absolutely true. It allows some of those other age groups to get vaccines. And I think particularly, we hear lots of people in different occupations who are quite worried about their risk of illness. And, the way the province's phased rollout of vaccinations work is that those groups who are essential workers can work from home are a little later in phase 2, nearer to June. This is giving an opportunity if they're 40 and above and they're quite worried that they actually have an opportunity to get vaccinated earlier.
Thanks, Penny. Up next, we have Paul Forsyth.
Hi, can you hear me?
Yep.
Thanks, Meredith. Hi, Dr. Hergy and all. Doctor, I think the current restrictions to stay at home, I think it's set to expire around May 20th or so. Your modeling, or the modeling that you quoted today, mentioned we won't reach about 75% first vaccination rate till about mid to late June. So is it sort of logical to assume that the province really has no choice but to extend those restrictions until approximately mid to the end of June?
Yeah, I wouldn't want to phrase it the province has no choice. They're, of course, free to make whatever choice they will. I would strongly recommend, though, that the right choice would be to extend the stay-at-home order probably into June until we meet what the federal government has put out there with closer to 75% of people vaccinated. And hopefully by doing so, we also are able to drive cases low enough that our hospitals are no longer seeing large numbers of people admitted.
A follow-up, Paul?
Oh, sure. And I think the first doses of Johnson & Johnson are starting to, or will be arriving in here. I guess at this point, we don't know what our allocation could be for Niagara, right?
Yeah, no, we haven't heard what the allocation of that would be, or even if it's necessarily going to be coming to public health, or if it's going to maybe be a pharmacy primary care vaccination. We've asked that the province give some of it to us here. We see actually quite a valuable role for us to be able to use this vaccine to vaccinate people who are homebound and not able to go to a vaccine clinic. This is a vaccine that'll be easily moved, and because it's one dose, you could actually quickly get to all of those people, vaccinate them, and give them some protection.
Okay, thanks, Paul. Up next, we have Gord Howard.
Hi, everybody. Dr. Hergy, online for today at least, the effective reproduction rate is 0.8%, which I know is a positive, good number. Is that an accurate number, or is it affected by the lab reporting that also affected the number of new cases? And is it a positive trend yet, or just possibly a one-day thing?
Yeah, what you're seeing, I think, is very much the impact of the reporting of cases have been low the last couple of days. So it's skewing that reproductive number lower. I have to check on our website. We have a graph on the third tab on the website. It's the second or third tab, the one called the kind of epidemiological trends, where we actually graph out the reproductive number over time, and we can see where it was a couple of days ago. I think we were around 1.1 or 1.2, which was an improvement from 1.4 where we were previously, but we hadn't quite got it down under 1, which is obviously the goal.
And a follow-up, Gord?
Yeah, I know since about the start of the month, there's been, I think it's 17 deaths in hospital, and I'm not sure they're all reflected yet on the public health website. We know we had the one woman in her 30s die. Do you know if any of those deaths involve other people in that younger age group, or what age group most of the deaths are happening in?
Yeah, I don't have information on those other deaths that Niagara Health has reported, which maybe we have not yet reported. I do note that Niagara Health in past weeks has been helping out some of the hospitals elsewhere in the province that are overwhelmed and don't have beds. So it's possible perhaps some of those were patients who aren't actually Niagara residents, and so they haven't shown up in our data. but it's quite possible that we just haven't finished our investigation. We usually want to seek out the death certificate, confirm that COVID-19 was a contributing cause to death before we'll report it out. So we're a bit slower to get deaths reported than Niagara Health is. What we are seeing in terms of the few deaths that we've had is that it's still very much an age trend in terms of the risk of dying. People who are older are more likely to pass away from COVID-19. As we get to younger age groups, the risk is lower, and that hasn't changed, but that risk is less skewed than it was before. And we're seeing a greater proportion of people who are younger having some risk of dying. Not seeing that so much in Niagara, where we've fortunately not had a lot of deaths in this wave, but across the province, that does seem to be what's being seen.
Thanks, Gord. And up last, we have Bonnie.
Hi, Dr. Hirji. Hi, everyone. My question is about vaccines. I know with the 40+ age eligibility opening up, people are on the hunt for vaccines, including people in Niagara who are going to hotspot areas to receive their vaccination, including myself. That's what I did over the weekend. Is that something you would recommend that Niagara residents go into hotspot areas to receive vaccinations?
Yeah, so I definitely want to commend people for their enthusiasm and all the effort they're making to get vaccinated. Definitely would prefer people to be going to great lengths to get vaccinated and wanting to be vaccinated than to be people who are not going to be vaccinated. I would perhaps caution a bit about going to hotspots to get vaccinated. First up, we of course have a stay-at-home order. We're trying to encourage people to limit their mobility and being out and about, and going to a hotspot where there's more infection spreading and greater risk is perhaps not the safest place for us to go. And when people do go on, say, one task, it may lead them to make a few other stops while they're down in the GTA. And that's something I'd want to discourage. The other part is that the hotspots are hotspots because they're seeing the greatest number of cases of COVID-19, but also higher risk of hospitalization and death. And the idea of labeling them hotspots was to try and get more vaccination there so we can have a disproportionate impact on hospitalizations and deaths. And so I would like to ideally see the hotspots be able to vaccinate their own people first to make sure that we actually have that biggest impact on hospitalizations and deaths over the province as a whole. Maybe if we're getting close to the point where it's the day before and a clinic still has appointments available, at that point maybe there's a greater chance that we're not taking an appointment away from someone else. But even then, I'd want to discourage people from really venturing out. Hopefully we'll have more vaccine coming here soon and people can sign up. And particularly for anybody who's 60 and above or 50 and above and lives in our hotspots, the L2G postal codes, please do go online. We still do have some appointments they can book locally here in Niagara.
And follow up, Bonnie?
Yeah, I guess when we're talking about reopening in June, what do you think the chances are that children will head back to school physically in the month of June before the summer?
Yeah, I think there's a reasonable chance that children could be headed back in the latter part of May or early part of June. We've taken a philosophy, at least amongst medical officers of health, that schools are essential, or they should be an area that reopens first before we reopen the rest of the economy. And so we would be looking to get to a point where we can reopen schools first, still leave everything else closed, and then delay reopening everything else until a little bit later. We've, I think, had relative success with schools. While no school is going to be 100% safe when COVID-19 is circulating in the community, we have been able to limit the number of infections. We've been able to keep outbreaks relatively contained and be able to continue learning for the vast majority of students. And so as cases come under control, our hope is that we'll be able to start to reopen some schools.
Okay, we've gone through one round. We have a little bit of time left. So if anyone wants to ask another question, please just let me know in the chat, okay? Okay, Gord, you're up first.
I know it's a decision that'll be made in Ottawa, but what conditions would you be comfortable with for the eventual reopening of the border?
Yeah, what I'd be looking at is, first, I'd want to see cases on both sides of the border to be relatively low, probably in the order of, say, 25 per 100,000 per week. So a pretty low controlled level of cases. right now, neither side on Canada nor in the US is seeing that excited with the Maritimes. Second, I'd want to see a pretty substantial portion of the population on both sides of the border vaccinated. So we'd be at least, I think, looking at the 75% here, but I would probably want to see us getting close to 75%, maybe having 2 doses of vaccine here. And likewise, seeing something like that in the US. And the US is a bit of ahead of us in terms of vaccination. So hopefully they'll be able to get there, but they're still looking at, I think, only about 50 to 60% of people have had 1 dose, and maybe more like 30 to 40% have had 2 doses. And then the third thing that I'd want to be sure is that there isn't some sort of new variant or particularly dangerous variant circulating on one side or the other of the border. And if there was such a variant, I think you want to keep the border closed to not let that variant come into your country until it's been smothered on the other side of the border. So, getting cases down, getting vaccinations up, and making sure there's no variants circulating on the side of the border. And that gives us the conditions where we can start to reopen the border. My hope is that those conditions could actually maybe be reached by the end of summer.
Okay, thank you everyone for joining us this week. And as usual, if you have any further questions, please email me or Carrie or Courtney, and we'll do our best to get those questions answered by Dr. Hergé. And we will see you all next week. Thank you.